Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient which you had requested. The area of interest is the upper right distal to the canine region. Now we've got quite a few BDRs in the upper premolar region and molar region, and the lower has a BDR and a bridge which is failing. Now this is the panoramic view. You can very clearly see that the panoramic view. We're going to take you to the transaxial view of the lower arch first. This is the lower arch. We've got a BDR with very thin cortical plate here. But this is the region. We've got 9 millimeters of ridge width, approximately 18 millimeters of height. The bone quality in this region is D1. This is the second premolar. Here again, you've got a periapical reducency, 9 millimeters of ridge width with approximately 20 millimeters from the crest to the inferior alveolar nerve. So here, once the tooth is extracted, our advice to the doctor would be to graft and not place immediate implants because of the thinness of the cortical plate. And if they do graft, in fact, they will have good cortical bone. Now, the superficial part of this only has 5 millimeters. Then we've got another area of 7 millimeters. And then from the 7 millimeter mark to the inferior alveolar nerve, we've got 14 millimeters in the first molar region. Moving to the upper first molar region, we've got approximately 13 millimeters of ridge width with a good 10 millimeters of height. All the bone in the lower is D2, whereas the bone in the upper right first molar region is also D2. The bone quality in the second premolar region is again also D2, but we've got 11 millimeters of ridge width with 12 millimeters of height, and the bone in the upper right region of the first premolar BDR, we've got 10 millimeters of ridge width with 16 millimeters of ridge height and D2 to D3 quality of the bone. Now we've also placed implants for the doctor. This is how this implants look, and then our doctor can actually slightly change angulation according to their area of interest. So if you have any further questions regarding these cases, please feel free to reach to our team. We would be extremely happy to help. Thank you very much.